distribution is on MDMA, which is known as the party drug. The history of MDMA. It was developed by a German pharmaceutical company in 1912 named Merck. The original purpose was to control bleeding. During the Cold War, the CIA experimented with MDMA and other hallucinogens for mind control. By 1980, MDMA became widely known as the party drug. In 1985, the DEA declared an emergency ban on MDMA, placing it on the list of Schedule I drugs. What is MDMA? MDMA is a derivative of the amphetamine family. It is completely synthetic and acts as a hallucinogen and a stimulant. It causes extreme euphoria, feelings of connectedness, increased energy, pleasure, and a distorted sense of time. MDMA is most commonly known as Molly or ecstasy. MDMA's appearance. Pure MDMA is a white powder derived from saffron oil, which is from the sassafras tree. Molly is the purest form of MDMA in the crystal or powder form and is usually put into capsules. Ecstasy is pressed into pills and stamped with logos. Ecstasy is often cut with things like caffeine, amphetamines, and ketamine. Here's an example of what ecstasy pills look like. The logos and imprints help build a following for ecstasy that is made in specific labs. Each pill usually comes in a 50 milligram to 150 milligram tablet that is swallowed. There are hundreds of street names for MDMA. Some of the most common consist of Molly, Ecstasy, E, Scooby Snacks, Stacy, Mandy, and Essence. Legality of MDMA. MDMA is illegal in every country. In 1980, the United States government implemented a series of laws and regulations called MDMA laws and penalties. Because MDMA is classified as a Schedule I drug and does not offer any medical benefits, it is banned from being used in any treatments. An individual caught manufacturing or distributing more than 50 grams of MDMA will be sentenced to at least 10 years in prison and a $4 million fine. If the distribution leads to death, a 20-year prison term and an $8 million fine. As you can see here in the bottom, this is a MDMA manufacturing station in somebody's home. Uses of MDMA. In 1970, MDMA was used by some psychiatrists as a therapeutic tool. They believed it made their patients more willing to communicate with them, although it had never received approval from the U.S. Food and Drug Administration. In the 1980s, MDMA became the party drug and was used at raves, music festivals, and dance parties. In 1990, the first trial for MDMA was permitted to see if MDMA could relieve pain from terminally ill patients. Today, MDMA is being tested in trials to see if it can be used as a psychotherapy for patients with post-traumatic stress disorder. There are many individuals with pre-existing health issues that should take caution when consuming MDMA. Individuals with heart conditions have a greater risk of a heart attack if taking MDMA. Individuals with hepatitis or other liver conditions may be more susceptible to liver damage if taking MDMA. People prone to seizures have a greater chance of consuming large amounts of MDMA. Individuals with psychoactive disorders can enhance symptoms when taking MDMA. Warnings regarding MDMA. Drugs sold as MDMA are often impure. A study done by the DEA between 2009 and 2013 showed that Molly contained mostly bath salts. MDMA is highly neurotoxic when taken in large amounts. The adverse effects of MDMA can be felt up to a week after consuming the pill. Also, MDMA should not be mixed with other drugs such as MAOIs and alcohol. MAOIs such as Narcan and Marplan are dangerous to mix with MDMA. They can result in a fatal syndrome called serotonin syndrome. Ecstasy is often mixed with alcohol because it is a party drug. Mixing these two can cause serious dehydration, liver damage, and insomnia. Below is an example of an MDMA tester kit. This kit is a quick test to see how much MDMA is actually in your drug. So as you can see, the yellow is a very low MDMA content, and the darker orange to brown, a very high MDMA content. This test is important because a lot of dealers cut their MDMA to increase profit margins. With this test, you'll be able to find out how pure the drug is. The desirable effects of MDMA. Individuals use MDMA mainly as a recreational drug. The desirable effects they obtain from the drug are increased mood, being more talkable and sociable, an increase in energy, a feeling of connectedness, and increased empathy. Also, increased appreciation of music, increased pleasure from the sense of touch. However, the side effects outweigh the desirable effects. Short-term side effects include anxiety, severe dehydration, increased body temperature, inability to concentrate, paranoia, blurred vision, and sweating. Long-term effects include insomnia, depression, sudden death, and severe damage to the brain. MDMA overdose signs include abnormal heart rhythms, high blood pressure, coma, panic attacks, and sudden death. Lethal overdoses are rare but can happen 2 to 60 hours after consumption. This can happen due to heat stroke, serotonin toxicity, and water intoxication. There is no antidote for MDMA overdose like there is for other drugs such as heroin. MDMA routes of administration. MDMA is available in a tablet, powder, liquid, and capsule, but it is mainly used in a capsule or a tablet form, as seen on the left. MDMA is usually taken orally, but also can be snorted, injected, and smoked. MDMA's mechanism of action. MDMA works as an indirect serotonergic agonist, increasing the amount of serotonin released into the synapse. It acts on the serotonin transporter and is transported into the axon terminal, and a release of serotonin is seen. After taking MDMA, little serotonin is available for release, and this is why the depressed feelings occur. MDMA also increases the release of dopamine and norepinephrine in a similar way that serotonin is released. Pharmacokinetics is the movement of drugs through the body. After consuming MDMA, it is absorbed by the GI tract and then distributed to the plasma and passed to tissues. MDMA is then broken down by the liver and excreted from the blood. This process can take 8 hours to be removed and then 40 hours to be 95% removed from the blood. Lethal dose of MDMA often overlaps the recreational amount. The typical dose ranges from 50 to 150 milligrams, but can vary. Doses over 150 milligrams can be very dangerous, especially if consuming more than one pill. As the dose increases, blood and brain concentrations of the drug enhance. Small increases in dosage over 150 milligrams increase the chance of toxicity.